You have exactly 4 to 12 hours to save someone from a stroke, or lose them forever. In those precious hours, 10,000 neurons die every single minute, and the window to reverse catastrophe is slamming shut. Your brain devours half of all the glucose in your body. It's the hungriest organ you have. So hungry that in children, the carotid arteries feeding it are the largest vessels in the entire body. Because of this massive energy demand, brain tissue dies faster than anything else when blood stops flowing. 10,000 neurons. Every single minute. Now, picture this. If you can get to a stroke center, and listen, these exist in every small city across the United States. We have one of the best stroke networks in the world. I work in this field and see it every day. If you can get there within 4 to 12 hours, you still have a fighting chance. During that window, the brain is still viable. Yes, some cells are already gone, lost forever, but there's still hope for recovery. Within those 4 to 12 hours, we can perform thrombolysis. Even if the stroke center doesn't have a cath lab or neurosurgeon standing by, we can still administer a medication intravenously that dissolves the clot. Here's the thing. A fresh clot is loose, red, made of fibrin strands tangled with red blood cells. But over time, those red cells break down. The clot hardens and turns white, and at that point, it becomes impossible to dissolve. Even if living cells are still there, desperately waiting for blood flow, you simply can't break through that clot anymore. Speed is everything. The faster you arrive, the better chance doctors have to pull you back from the edge. The second option is endovascular surgery, and it's like something out of science fiction. We thread a catheter up through the femoral artery in your leg, or an artery in your arm, navigate all the way up into your brain, usually into the middle cerebral artery, which is where 80% of strokes happen. This artery feeds either the right or left half of your brain. Using an incredibly sophisticated device, we literally suction onto the clot and pull it out, restoring blood flow in an instant. When there's a cath lab available, this can be done within 6 hours. And if there's what we call a penumbra, a twilight zone where part of the brain has died, but part is still alive, still clinging to survival, we can go in and retrieve that clot even beyond 6 hours. So, what puts you at risk for ischemic stroke in the first place? First, high blood pressure. If your pressure stays elevated day after day, your risk skyrockets. That's warning sign number 1. Second, atherosclerotic plaques in your carotid arteries. A simple ultrasound of your neck can reveal these, even in younger people. When I used to smoke, my vessel walls already showed early changes, thickening, the beginnings of plaque. Your carotid arteries are a window into the health of every blood vessel in your body. This is critical. If you have a plaque blocking more than 60% of the artery, it needs to be treated. We can do a carotid endarterectomy, make an incision, open the artery, and physically peel that plaque out, like turning a sock inside out, then sew everything back together. Or we can use the gentler approach, stenting. We go in through your arm or leg, inflate a tiny balloon to compress the plaque, slide in a stent, and let it expand against the vessel wall. Problem solved. Plaque is one of the most important predictors of stroke. If you have it, especially if it's large or unstable on ultrasound, you absolutely must take statins. Statins don't just lower cholesterol. They reduce inflammation in the vessel wall. They cool down the plaque itself. When plaque becomes denser and less inflamed, the chance of a clot forming on it drops to almost zero. Then there are blood thinners. After 55, something like low-dose aspirin matters. I know there are studies. I know doctors argue about effectiveness. But let me put it this way. Your blood has 12 clotting factors and 12 anti-clotting factors, balanced like a scale tipping back and forth. When you take even a small dose of aspirin, you're placing one little weight on the side that prevents clotting. Just one small shift. And that shift can save your life. Obviously, stronger therapies, dual antiplatelet drugs, anticoagulants. Those need a specialist and specific indications. But the principle is the same. Tip the scale away from clotting, and you tip it toward survival. High blood pressure, plaques. Now the next major factor, irregular heart rhythm. Sometimes clots don't form in your arteries at all. They form in your heart and fly up to your brain. When your heart rhythm goes haywire, the atria stop contracting properly and start quivering. Like they're dancing at a disco, just wiggling uselessly. In the little ear-shaped pouches on the atria, clots form. And when one breaks free, it shoots straight into the first vessels branching off the aorta. The ones feeding your brain, the most vital organ your heart supplies. Stroke. And here's the nightmare. These clots dissolve poorly with thrombolysis. Even clot retrieval struggles because they're old, mature, white, and rock hard. That's why you need an EKG at least once a year to catch rhythm disturbances. If your rhythm is off, your cardiologist will prescribe the right blood thinners, Eliquis, Xarelto, whatever you need, to stop clots from forming in your heart and traveling to your brain. Monitoring your heart is life or death. That covers the main causes. Prevention starts with controlling your blood pressure. High pressure is like forcing more water through a garden hose than it can handle. It warps, it twists. Except this hose is alive. It tries to reinforce itself, patch up the damage, become denser and thicker. But high pressure keeps tearing it apart from the inside. So monitor your blood pressure. Get EKGs. Watch your heart. Ideally, get an echocardiogram too. See how your heart muscle is actually functioning. And get an ultrasound of your carotid arteries once a year. It won't show every plaque in your body, but it's a mirror reflecting the health of your entire vascular system. Now let's talk lifestyle. The more you move, the better your blood flows. Everything works differently. Walk for at least an hour every evening before bed. If you do this every single day, your life will change. You'll feel better. Sleep deeper. Because that fresh air and gentle movement will give you real rest. Less risk of arrhythmia, less atherosclerosis, fewer plaques. Bottom line, move. We live in an era of sitting and staring at screens. Break that pattern. And here's the big one. Quit smoking. Cigarettes destroy your vessels from the inside, day after day, silently wrecking everything. As for diet, it's not fat you need to fear, it's sugar. But that's a whole other story. I'll see you in the next video. Subscribe, hit the like button, leave your comments. I'll answer what I can, or my team will jump in when possible. Take care of yourselves and be loved.